we're towards the very end, but now we're going to go ahead and let Taryn move forward. Thank you, Taryn.
Thank you. I'm going to steal that joke 100% in the future. So,
Yes,
hello,
please.
everyone. Good afternoon. This has been such an amazing conference. It's been our third conference, our third annual virtual conference that we've done as a coalition. And again, it has been a really great collection of panelists and presenters talking about all kinds of great topics. So thank you all so much for joining. And we are just coming to the end of our conference here, but don't leave. I have a quick update about the coalition. So if we haven't met yet, I am Taryn Walstad. I am the advocacy lead for the coalition, and I will be sharing this update about what we've been up to in the past year. All right, but quick overview of who we are. So the Arizona Oral Health Coalition exists to create meaningful discussions and impactful change to address oral health disparities throughout Arizona. So our mission is to be the catalyst for oral health policy and systems change that benefits all Arizonans, especially underserved communities, by uniting health advocates, community and state leadership, and like-minded organizations. All the work that we do is to achieve our vision, which is that all Arizonans enjoy the benefits of optimal oral health as an integral part of overall health. So, as a coalition, we strive to bring people and organizations together so we can have that great impact. Our goals are to provide unity and leadership for policy change and advocacy efforts. Here we have pictures from actually last year, so 2024's Capitol Day, some of our policy change and advocacy efforts in practice. We also have a goal to create networking and collaboration opportunities to maximize impact and reduce duplication of efforts. This conference in and of itself is part of that goal to make sure that we are able to share what's going on and connect with other organizations. And then our final goal is to provide oral health advocacy resources, information, and technical assistance to communities and professionals to empower them to reach their goals as well. So in the past year, we've been up to a lot. We've continued advocating for an adult dental benefit as part of our state Medicaid program. As we've heard today several times, that is such an important piece that we are missing right now for access to care. And so every year we are building momentum and continuing to fight for this. As we are doing this year as well, we hope to see it included in the budget. The bill, just as a quick overview, it did go very far. We had a lot of conversations with state lawmakers about the adult dental benefit and how it would be really important for the state to have that. And it hopefully will be included in the budget. I know budget negotiations are ongoing right now. That is certainly a closed door conversation. So I wish I had a little bit more insight into how that's going. But we are really hopeful about that. Also in the past year, we've found some new avenues to promote oral health, such as providing education about fluoride or Suboxone, which I'll get into in a minute here. And of course, in the past year, we've been proud to attend and provide opportunities for building connections and learning about oral health equity. And I'm also excited to announce that we have applied for another round of funding. So we look forward to another powerful year. All right, so advocacy is one of our main focuses, and we've continued advocating for that adult dental benefit. And many organizations across the state have supported this policy as it is a really crucial step for expanding access to care. And we've seen representatives from the Dental Hygiene Association, the Dental Association, and other community-based organizations writing their legislators, attending committee hearings to speak about the importance of this. And so it's been really great seeing such a wide network supporting this policy. And I really want to give a shout out to our fiscal sponsor, Children's Action Alliance. I'll spell out what CAA is. They have taken really important steps to lead this effort. such as securing a sponsor for the bill and tracking progress and sharing action alerts. That's something that we've been doing in close partnership with CAA, and it really helps provide that leadership for that network of supporters to hone in and have an actionable impact. So as with previous years, Senator TJ Shope did sponsor that bill, and we saw really strong bipartisan support this year. We even found some unexpected champions in the Senate, so that was really great. And we are hopeful that the momentum will continue as we navigate potential challenges stemming from policy changes at the federal level. We are aware that there are daily news updates about changes at the federal level, and we are following it and seeing how it will impact our efforts at the state level. And here on the slide, we have photos from our Capitol Day. So all of our advocacy work wouldn't be possible without our amazing partners and network of oral health advocates. This network meets at our advocacy committee meetings, and several of us joined to do our in-person Capitol Day in March. And so we have pictures of some of the folks who joined. And I appreciate if you have photos from Capitol Day, just a quick side note, and you don't see it up here, but you want to share, let us know. You could throw it up in our next newsletter. All right, also in the past year, we were so excited to be able to provide more learning and connection opportunities for our members at virtual events. So we had a variety of topics and speakers, including a social media and branding training with Totem Concepts. We had Julia Waskloff with the state public health department, excuse me. She presented the recent Arizona Smile Report. Kelly Rubio with Mayo provided a CE about myofunctional therapy. And then we had presentations from Coalition LT members to provide to our coalition partners, including a presentation from Tammy Baca about special needs dentistry. And I provided a few webinars about the advocacy toolkit and about systems change. And something that was not open to all members, but was very exciting, is we did a presentation to NAU dental hygiene students about advocacy. So it's really great to make sure that all the new professionals are aware of the importance of advocacy for the profession and have the skills to have a say. And this past year, the coalition was in the field at opportunities to meet new folks and promote oral health. So that first picture there, we attended the Oral Cancer Walk in October and got to meet a lot of folks. And then also the picture on the right here, we were able to attend the Tribal Opioid and Substance Use Conference. And so not only were we able to meet folks at these events, but we were also able to share information. So small soapbox moment. We are doing presentations about Suboxone and how it has an effect on teeth. So if someone is using this life-saving, very important medication, they should not stop taking it, but there are some cautions about how it can affect teeth. And thankfully, the FDA has released some guidance. The short of it is please rinse with water after using Suboxone to prevent cavities, but many people are not aware of this. This is brand new FDA guidance. And if you would like to have a small presentation to your office or to your organization or at an event like we did with the conference, we are happy to provide that presentation. And we did so at this event, and it was really great to meet so many new folks. Right. And another high point from the past year was we created some new resources. So we have 2 new fact sheets. These are available on our website. One is about Suboxone, as previously mentioned. And then we also created a snapshot on oral health data for Native American adults. And then we also have a new LinkedIn page. This is new from the past year, where we featured Fluoride Fridays with lots of facts, myth busting, cool things to know about cool fluoride, because we are very pro fluoride. And it is increasingly important to be talking about the benefits of fluoride. So we had our Fluoride Fridays. Those are all up on our social media, our LinkedIn and our Facebook. And so I highly recommend checking those out. All right. So I want to thank you all so much for continuing to support our work and for the work that you all do every day to make Arizona a healthier place for everyone. I hope that you will continue to connect with us. We're always happy to hear, what your ideas are, what you'd like to see more or less of, or if you have any ideas for events or things to try out, please do reach out. The number one way to stay updated about what is going on with the coalition would be our newsletter. So if you're not signed up for that, please do sign up. I'm actually dropping a couple links in the chat right now. Another great way to stay up to date is by following us on LinkedIn and Facebook. And all the events that we do are open to anyone who is interested in protecting oral health. So that goes for our committee meetings, our conferences like this, or for any other webinars. So make sure you are taking a look at our calendar and our newsletter to see what events are coming up. We have plans for next year, so stay tuned. And finally, we're going to stay curious and keep the conversation going with these 2 virtual events coming up later this month on May 21st and on May 30th, both at noon, both virtual. Please do join for a conversation. May 21st is about mobilizing to protect fluoride and specifically, I believe, community water fluoridation. And May 30th is about taking action amid federal changes. There's a lot going on to federal offices, at CDC, things like that. So it's time to have a conversation about that. All right. Well, that's all I got. That's our update, please. Oh, happy hour is at night, like 5:30, says Tammy. All right. Well,
Yeah,
there will be
one on the
messaging going out on
21st.
Monday.
Yeah, that's the one on the 21st. I was like, no, the other one's like, yeah. So sorry, Tim.
Thank you so much.